Natural history of disease is a very important question. Basically, first define it. It is the natural course of the disease where there is no prevention, no treatment, no intervention happening. So basically, it is the sequence of events of a disease from the earliest stage to its termination without prevention or treatment, or you can say without any intervention. So basically, termination can be either recovery, disability, or death. So there is something more you will have to write here. Every disease has its own characteristic history. It has its own characteristic history, and that too it differs from one individual to another. That's weird, right? History, and that too which differs from one individual to another. Now coming to this, they can ask you what are the phases of natural history of disease. In that you have only two phases, pre-pathogenesis and pathogenic phase. Okay, what and will you have? Pre-pathogenic and pathogenic phase. Only two phases, nothing to worry. Pre-pathogenic phase and pathogenic phase. What happens in pre-pathogenic phase? Let's look at that now. So pre-pathogenesis is actually before the disease actually comes to you. So there is an agent in the atmosphere, in the environment. It still has not entered the host. Okay, this is the pre-pathogenic phase. Here you will have to draw this epidemiological triad and also explain it. So basically it's a culmination of three things. The host should be very susceptible. He should not have strong defenses against this. The agent should be virulent. The environment should be favoring this kind of a disease state. So that is the epidemiological triad. All the three have to come together. It is not possible for an agent to cause a disease if there is no host, and the host cannot get the disease if there is no agent. Similarly, all these three factors should come together. And in this case, in this stage, in this phase of natural history of disease, you can have prevention. That will be primordial prevention and primary prevention. Primordial is something like it is the disease has not at all existent in that place, but still you have done everything to make sure that it doesn't even come there. Primary prevention is there is that disease in that area, but you're making sure that people are not going to get the disease. Okay, at least the newer people. Modes of intervention here will be health promotion and specific protection. This will be specific protection is immunization. Health promotion is health education, nutrition, lifestyle changes, and what is the other one? The other one is environmental modification. All those four comes under, they come under health promotion. Okay, this is pre-pathogenesis. Now coming to pathogenesis, in this you have two phases, subclinical and clinical. Subclinical is when from the time of infection it starts, and this will go into circulation, it will multiply, and there will be changes in the body. Clinical stage is where you can see the signs and symptoms. There is an illness, there is a chronicity, and this can lead to termination by recovery, disability, or death. Please note here there is no treatment. Okay. What are the levels of prevention? Secondary prevention and tertiary prevention can happen here. Modes of intervention will be early diagnosis and treatment, disability limitation, and rehabilitation. The other three modes of intervention. But basically in natural disease, history of disease, this intervention will not be there. But if you want to have intervention, then you will have to have these three intervention in the pathogenic phase. You will have to draw a diagram. Basically, this is the advanced model of triangle of epidemiology. Causative factors, groups of population and their characteristics, environmental behavior, culture, physiological factors, ecological elements. You can refer Park for this. There is a diagram like this which shows the pre-pathogenic process and the pre-pathogenic phase and the pathogenic phase. Here you can see the epidemiological triad. Here you can see the subclinical, and here's the clinical horizon, and the levels of prevention and modes of intervention. So we can also draw this kind of a table and put some differences between pre-pathogenic and pathogenic phase. What are the differences? You will say pre-pathogenic is before the onset of disease. Pathogenic is after the entry of the agent, and here you can say the primary level of prevention is possible here. So basically here you will say primordial and primary prevention. Here you will say secondary and tertiary prevention. Here you can actually, in the pathogenesis, now you can also add something like incubation period. Okay, I think this diagram is important and you'll have to learn it. In the human host, early pathogenesis, early lesions, advanced disease, interaction of host and stimulus, host reaction, tissue and physiologic changes, immunity, resistance, recovery. Here there is some incubation period also, okay. Signs and symptoms, illness, disability, defect, chronic state, death, or it can lead to recovery. Please look at this diagram. If you draw this, you will get a lot of marks. So this covers natural history of disease.